Yes, it's me again, Norman Harris, CEO of Comfort Measures Consulting and the host of the Let's Get Comfy podcast. We're back here yet again, and I want to thank God for it. And I'm happy and I'm excited. 2026 Florida Healthcare Association conference and trade show in Orlando, Florida, live, the premier podcast, the Let's Get Comfy podcast. We got the chairs here, we got the sign here. Major shout out to my sponsor, my CEO, my man, Dr. Hussein Ballou, Evolutionary Healthcare, the number one healthcare organization in the state of Florida. I want to give a shout out to our sponsors for sure, pushing that holistic health and functional medicine. But to kick us off here this year for our interview series, I have J.A.D. infection control experts, the CEO and founder with me, Ms. Joy McMillon. Thank you so much for being. Give you a round of applause.
Thank you.
For sure, for joining us today. All right, so I always let our stars of the show, I call them, and our spotlighted guests, introduce themselves. So, Ms. McMillon, if you'll please share with our audience who you are and what you do.
Well, thank you for having me. Number one, my name is Joy A. McMillon, and I put the A in there because I'm not the playwright and I don't have an Oscar. However, I am an infection control consultant as well as a regulatory compliance consultant, and I mentor leaders who are trying to find their way in healthcare so that everyone can get quality healthcare.
All right. Well, that's great. That's a great mission, a great initiative, and it's definitely needed in the healthcare and advocacy space. So, to kick us off today, we're in an elevator, right?
Yeah.
From the lobby floor to the 30th floor. Tell me why you are the infection control expert.
Well, that's an easy one.
All right.
So it is my passion, but I'm also great at it. I was able to have one of the only facilities, well, the only facility to be COVID-19, no healthcare acquired COVID-19 infections.
Oh, wow.
So that was the beginning of my journey as a consultant.
Okay.
But yeah, that puts me in a league of my own, and I love to own who I am.
Gotcha. I love that. Well, now also I do my research as well, and learning about your history. You actually started out as a CNA.
Yes.
All right. So, as CNA, watching healthcare as it associates to infection control, what moment from those early days that still drives you to today as you are a CEO of your own organization?
That's a great question. As a CNA, one of the first cases I remember was taking care of someone with a wound, and they had a wound vac, and that wound vac, they ended up with an infection which caused them to have a bone infection, which caused them to end up with sepsis, and that person actually lost their life.
Oh, wow.
And so the importance of infection prevention really, really stuck with me. And so it's part of my passion just to make sure everyone comes in, hopefully leaves better than when they got there.
Got it. So we here at Florida Healthcare, the conference and trade show, of course, we have different educational sessions here. But one of the topics that I want to discuss with you, because you're in infection control, right? You're in nursing, you have the background. One of the major topics, though, because I would love to just ask this from your perspective, is turnover, right? Staffing was one of the subjects that they spoke about. Turnover is a significant issue in the healthcare space, definitely in Florida with our aging population. How would you address that?
Well, I'm glad you asked that one because I love to do, that's part of my mission, is to be able to empower leaders by mentorship. And so I spend a lot of time mentoring new infection preventionists, new directors of nurses, some who are, let's just say, they've been in leadership, but they don't have the soft skills needed to retain individuals. So that's part of what I do. And it's just a passion of mine. I was always able to retain my staff because of how I treated them.
Gotcha.
But there's accountability that has to go with that. So it's how you do it.
Right. So with you working with leaders, Most leaders think infection control breaks down in the obvious places, right? And this is kind of connecting it back to
Yeah.
infection control. Where does it actually break down that catches facilities like completely off guard, right? Like, because everybody, you have your infection control protocol, right?
Yeah.
You have an infection preventionist
Yeah.
certified in the building. But what are some areas that catches them off guard that working with the infection control expert, all right, can be a benefit for that organization?
So what catches people off guard is what they don't realize is so many times the actual workers are trying to do their job. So it's not like they're trying to do something wrong. They're just trying to cut corners. And
Mm,
most of that is things that you can guide them and help them to understand the why. It hasn't that they haven't been taught before. It's helping them to put together, okay, this is your workflow, but this is the why behind it. So as you just did that, you're kind of setting back the person you're trying to help, which defeats your purpose. And then they understand it a little bit better. Yeah.
like, how does your services would benefit a, let's say, environmental services organization, a dietary, a nutrition company?
Well, that's really important because one of the first places the surveyors are going to go, and it's this last place that infection control personnel that are in the building sometimes go, and you have to lead them down that passageway, is the kitchen.
Mm,
They walk and they go straight to the nursing unit and straight to the kitchen before you can clean up anything. Before you know that they're there, they're going to find anything outdated, anything bent, anything that's, expired, all of those things. They're going to find it. So it's my job to make sure that I'm putting you where you need to be. I'm giving you the game because it's an open book test. People just don't have the time to open the book and
open
read
the
it.
book. So thinking ahead to 2027 for J.A.D. infection control experts, I know you have a mission and dedication in the healthcare space, but do you have any other plans to extend your sort of octopus arms out, your branches out to other areas?
One of the things that I have been branching out into is leadership speaking. And I know it I'm doing healthcare. I've been in healthcare all my life,
Mm-hmm.
but I've also been a leader. And people are reaching out to me to speak for leadership
What
opportunities.
do you
And
enjoy about speaking?
oh man, what I love to do is make sure that the audience is number one, informed,
Mm-hmm.
entertained, and engaged.
Yeah.
I mean, if you can't do all of those things at once, then you're really dropping the ball when it comes to being a speaker because, some people, they have a personal story.
Mm-hmm.
Some people, they're speaking. I'm coming from a place of where most of them have been and are still.
Yeah.
And I'm helping to uplift them, encourage them, and help them to understand whatever concept of the day it is that I'm trying to teach.
Right. Right.
So it's really I see myself doing more of that.
Well, I tell you what, I had the honor of seeing Miss Joy firsthand, live in action, in person. And when I tell you, she really knows how to take control of a room. Every single person in the audience was engaged. So yes, if you have any summits, symposiums,
Yes.
conference coming up, you need a good keynote speaker or presenter, definitely Miss Joy McMillon, and I can tell you from personal experience, and you will hopefully will partner in the future and
Yeah.
future events with Comfort Measures Consulting as well,
Yeah.
as we extend to doing other event networking events, summits as well. So definitely, I love that for you as well. I could definitely
Thank
see that.
you.
Yeah,
Thank
I really
you.
do. So we're gonna end this session today.
Okay.
One, talking about, I want you to share two things.
Okay.
All right. How can someone reach you, connect with you, and share with your social? Okay.
Okay. So if you want to connect with me, you can go to jadicc.com. And my social, if you're looking for me, If you're on LinkedIn, I'm on LinkedIn. You
Yeah.
can't miss
Can't
me.
miss her.
I'm there, trying to put out information for you guys every day. The other place, not as much, but I do have a Facebook account and I also have an Instagram account,
Yes.
Joy McMillon.
Joy
So
McMillon.
that's where I am, but I look to see you all soon.
For sure.
Probably mess up more than y'all, by the way. All right. The stage is set. Right. This time, I have a dynamic duo, K and K, and we're representing our sponsor here today, Evolutionary Healthcare, and I have the clinical leaders of the wonderful organization, and I have the joy and pleasure to work with them each and every day. K&K, Miss Katelyn Reismiller, our Vice President of Clinical Operations, and Kara Hagan's, our Chief Compliance Officer. Welcome to the Let's Get Comfy podcast. Round of applause for you, ladies. Thank you so much for joining. All right, y'all still nervous or no?
Little bit.
Little bit, man. Let me see you laugh. Give me a big laugh, Kayla. You know how we laugh all the time. All
Yes,
the time. You
yes,
don't have
we
to be
do.
nervous. So I want to start off just talking about your journey professionally. And we all have the pleasure to work for Dr. Hussein Blue, our CEO and medical director. But if you would share with our audience, I'll start with you, Katelyn, first. What was the biggest turning point in your professional career?
So actually, Norm, the biggest turning point in my career is joining Evolutionary Healthcare. I was just basically focusing on clinical, rounding in the nursing homes, and Dr. Ballou has allowed me to get into more of a leadership position where I can actually train and teach, and it's something that I really enjoy.
Yes, that's good. All right, Kara?
A very similar situation from going from direct patient care to being in a leadership position with being clinical officer and compliance officer. And so I have the ability, instead of necessarily, impacting one patient at a time, but I can actually impact, thousands, hundreds and thousands all at one time by being
Yeah.
in this particular position. So that's been absolutely a turning point for me.
Well, I want to give a shout out to B. You recruited some wonderful individuals, man. I really enjoy working with them. I'm not lying either. I wouldn't say it if I was lying. All right, so Evolutionary Healthcare is we're the only provider in Florida bringing OMT, osteopathic manipulative treatment, into the skilled nursing space. To you all, I want to ask you, Kara, first. What is it like building something essentially that didn't exist yet? And convincing others, right, to pioneer this into their facilities.
Well, at first I'm going to say, just to play on words, it's evolutionary.
Oh, I like that. The evolution is here. I like to say.
Absolutely. So
Yes.
it's amazing just to see something that, facilities haven't seen before. And it's such a wonderful specialty. Whenever I started working for this company, it was just amazing to see how we can use, osteopathic treatment to really affect the quality of life of the people in the nursing facility.
It's good, Kara. So, Katelyn, I ask you, we're talking about OMT, osteopathic manipulative treatment. I have to say it fast because I'll mess up. Tell us about what OMT is and tell us how you've seen it integrated in the post-acute space.
So OMT is gentle hands-on therapy. The doctors put their hands on the patients. They pretty much realign the muscle tissues, fluids in the body to help the body get in alignment to be able to heal itself. I've seen amazing things with OMT. You would not expect it, but it relieves pain, it improves mobility. Patients are just ecstatic about it once they receive it.
Yeah. So I want to talk about that. You think about the diagnosis. If you could list some diagnoses that you've seen patients actually benefit from.
So lymphedema, which is swelling of the legs that does not respond to water pills or diuretics. Patients have responded with paralysis of one side of their arm from a stroke. I've seen great things happen along with therapy to help with their mobility and actually be able to gain back some of the movement along with physical therapy.
Wow.
Also with constipation.
Yeah.
You might not think about that, but that's a major concern in the skilled nursing facility, and OMT really helps.
Yeah, it helps. Actually manipulating from all hands on will help a person relieve, constipation. Like I've seen it too. So I was so impressed from a visit. I actually was rounding with one of our providers,
Yeah.
and actually saw that happen. And the patient actually asked us if we could step out of the room. Yeah, I said that on camera. Yeah, but yes, it's very much true. It
That
did
quick.
happen. So manipulation, hands-on. We're bringing non-pharmacological interventions in the clinical setting, which is very important. Our motto is getting to the root cause of the pain instead of masking it with medication, and providing another alternative. And I say to leaders out there, healthcare organizations, what's wrong with offering your population another alternative to care? That's all it is, another option. So, Kate, Kara, I ask you this question here. So, if a facility have never heard of evolutionary healthcare or not familiar with OMT, and they say, hey, we want to do a live demonstration, set up a presentation with our team, right? We do the live demonstration, and they want to integrate OMT into their services. Walk us through what they can expect from onboarding and to after their first 90 days we're working with us.
So
Let's
demo
start from the demo
tip-
with Magic Man with the magic
as they
hand.
say, demos.
Yeah.
Typically, you and the physician are going to go to the facility,
Mm-hmm.
and then you will do a live demo on the facility
Who is you?
administration.
Who you talking about?
You.
Me, yeah. Your boy, me, my man, Dr. Mara, the magic man with the magic hand. We show up at your building and we get the best demonstrations you and presentation you ever had. I'm telling you. But go ahead. Sorry, Carol.
Absolutely. I mean, I think that's one of the strongest points is the physician being able to go into the building and actually performing OMT on the ED and the DON. It just, whenever you actually get to experience it yourself, it really is life changing. And then from there, we give them the paperwork as far as the consents and the consults, explain that process. If we want to go into the operations process, then just credentialing the physician in the building and then the NP or the PA, and all of the logistics of the EHR and integrating everything as far as that, and then just basically getting all the physicians and everyone ready to get set up for success, and then starting on their first day to be able to go around and see everyone and just improve the quality of life.
Right. And I tell a lot of physicians and facilities that we present to, we're one of those organizations. Once you integrate us, you almost forget about us, right? Because you only really necessarily dealing with an actual physician, a nurse practitioner, or a physician assistant. But this is a complimentary service to what you're already doing. But it's something that make people feel good as well, right? So the concerns or the complaints that may be generated from other providers or other vendors that you partner with, you don't really deal with that from Evolutionary Healthcare.
Oh, absolutely.
We make people feel good, baby. All right, so rapid fire time. All right, for you. All right, I'll start with you, Kara. All right, one word to describe what OMT feels like your first time you tried.
Relieving.
Relieving. I like that. God, that was too fast. I thought you were gonna ponder. All right. Next, Katelyn, to you. What's one condition you've seen OMT help with that genuinely surprised you?
The lymphedema with the leg swelling. Just by their hands moving the fluid through the tissues, getting the fluid back where it should be, the swelling over time greatly improves.
Yes, I actually show a photo with permission, like it's no patient information, right? We comply HIPAA over here at EVOHC. During my demonstrations, I show a photo of a before and after of patients actually receiving manipulation from the swelling in their feet. And it's time stamped. You know how your photos are time stamped in your phone, but to show that before and after, like it's real, actually, and it really works. As I always say, seeing is believing, but a treatment is your own testimony. So that's a great. I love that one. If you could, Katelyn, back to you again. If you could have OMT on any part of your body right now, what would it be?
Well, Norm, there is this spot I got back here on my back. I don't know if it's from working out or whatever, but I think I would ask for them to check out my right lower back.
Lower back. That we hear that a lot. Your neck area is an area we
That's
have.
another one.
Yeah. So a lot of times, why is it so hard to get people to really buy into integrated OMT? What's your, just any one of you can answer that question.
I think initially it kind of sounds too good to be true, and people don't believe that just the laying on of the hands with really works. But once they experience it and hear the reports from the patients, then they're believers.
Believe me. They have to see it, huh? And they have to have a treatment.
That too.
Yes, yes. Well, I tell you, I really enjoy what I do. I really enjoy bringing holistic care, functional medicine to individuals and actually educating and something groundbreaking. But as we know, OMT has been around many years. It's primarily utilized in sports medicine with athletes, helping with performance. But we actually pioneered with trialing out in the senior population, and it's working. If integrated appropriately, we understand that the facility personnel does the work, right? It's not an end all be all. It's not a magic trick to reducing falls or reducing narcotics, but it's a great service to have and is a great benefit to your patient's overall functional health, but also customer service as well. I love collaborating with you ladies. But thank you for joining the show. How can they reach you directly or reach Evolutionary Healthcare? What's the best way you say?
I would say email, definitely email. For me, Kara at evohc.org, and Kara with a K.
Care with a K, yeah. Uh-huh.
You can just tell Norm you need to talk to me,
Or
and he'll
actually,
let me
yes,
know.
that's the best way.
Just tell Norm.
Yeah.
He'll let me know.
That's the best. I thought you was gonna say that too, but you gave it to Katelyn.
There you go.
Katelyn
That's why we have Katelyn.
Katelyn, yeah. Katelyn gave the right answer. She trying to get her emails blowed up. But,
Definitely not.
but yes, Harris at evohc.org is me. I can't wait to speak to you and give you and your team the best presentation y'all ever had. Hit me up. LinkedIn, I ain't hard to find. Till next time.
Thanks, Norman.
Thanks, Norm. Thank you.
Whew.
Okay,
Sounds good.
Well, first off, Norman Harrison, Listen Come Podcast. You know who I am, but I bet you don't know. Well, you need to know my man right here. Introduce yourself, John.
I'm Josh Wagoner. I am a divisional director with Aviata Health Group, and I am the new Florida Healthcare Association president.
The president.
The president.
Mr. President. Yes, sir. Congratulations, my man.
Thank you, sir.
Yes, sir. Yes, sir. All right, two questions for you, Josh. If you could change one thing in healthcare tomorrow, without any politics involved, no budget, what would it be and why?
No budget. Man, that's tough. It is a great question. And one thing is hard to do because I want to do so many things with that question.
Yeah.
For me, just because of the involvement I've had with policy, with, working with both the Tallahassee legislature and up in DC, the biggest challenge we always seem to have is making sure we have the right funding for our nursing homes. And I call them care centers, and that's what I love to call them. But if we could have it where our funding was just kind of concrete every year, we know we have this many, whether it's Medicare, whether it's Medicaid, state by state, if we had nothing, if I had no rules, no regs, I could do whatever the hell I wanted.
Yeah.
It would be, hey, every state, your Medicaid funding is set every year before anything else happens for our care centers. And then same thing for the federal government, like, hey, Medicare, they don't have to deal with Medicare Advantage. They just have regular Medicare and do what they want with that as well. So I would love to do that because that would be half of our headache gone, number one. But also number two, I feel like it would give us so much more freedom to really focus on the residents.
Yes, sir.
And because that's like half our battle. We're always fighting for more money and more things so we can do right by our residents. And that's what it's all about.
Yes. I love that answer, man. Being the new president, I know you got the honor today.
Oh, yeah.
But share with our healthcare leaders what they can expect from your tenureship.
So I have a lot of great ideas. I do. I don't know if I'll be able to do all of them.
Yeah.
But like one of my biggest
Give me
tenets,
one of them.
one of the biggest tenets is we really need to strengthen our workforce. And from my perspective, it's more so finding the next generation of leaders. One thing that I struggle with in Florida is we are where the world comes to retire, right? The world comes to retire in Florida. And we don't have great training programs for the next round of administrators and directors of nursing.
No.
And I think our colleges, whether it be FAMU, USF, FSU, UF, UCF, any of the state colleges and state universities, we should have dedicated programs that focus on long-term care, whether that's working in our nursing care centers, working in assisted living, doing hospice. There should be a focus on that, not just the hospitals. And that's one of my big focuses, how we can recruit and get these people in here and build programs with our state universities and colleges. That's
I
my big
love
one.
that.
Yeah, it's gonna be a lift, but I'm very passionate about that.
I love it, man. I think that's great. And final question for you for our pop-in interview today. If I know you just started with a new role, but I
Yeah.
want to ask this question. If you had to give it all up being a healthcare professional tomorrow, what would be one piece of advice that you would want to be remembered by?
The relationships I've built, and because our profession, our careers, it's all about those relationships. And I'm talking not just the peer-to-peer. I'm talking the relationships with those residents, those relationships with those family members, the relationships with your CNAs, dietary aides, all the way up to your management team and everything between. It's all about relationships.
Yes, sir.
And you have to have and build great relationships, because I say this a lot when I was still running buildings. Like, I would say it a lot. I could be the best administrator in the world, but if I didn't have the rest of my staff, I am nothing.
Nope.
And so it's all about those relationships and building people up, giving them the tools to do their job well, and then get the hell out of the way. That's
Yes,
the biggest
sir.
thing. So let them do their well. So, but relationships, build those relationships. Take the time. Take the extra 5 minutes. Get to know someone.
Yeah. Hey, you heard it straight from Florida Healthcare Association new president, Joshua Wagoner. Thank you so much for popping in, man. You've been a supporter from day one, man. I really appreciate you taking time. You showed me your calendar, and you were in line, man. You were jam-packed. So you making time to stop over here, man. I'm very grateful, man.
Norman, I'll do it anytime, my friend.
you, my
Even if
man.
it needs to be on top of the building, you let me know.
Yes,
We'll make it
sir.
happen. All right,
Hey,
buddy.
Thank you for hanging in with us here. We're still live at Florida Healthcare Association Conference and Trade Show. And I have a special treat for you today. Another one. Legend in the long-term care space, Mr. Michelangelo Mortellaro with Mortellaro Law. Have joined the show. Round of applause for you, sir.
Thank you, sir. I appreciate the opportunity to be
Yes,
here.
sir. Thank you so much for being here, joining the platform. This has been a little while in the making, too, by the way. You know, Miss Tammy Erickson been trying to make this happen, but we made it happen here in Orlando, man. I'm very grateful for you sharing the platform, but your expertise to the audience as well, man. Double salute to you, too.
Anytime.
Yes, sir. So, as I always do, I always allow guests to introduce themselves. And I want you to brag on yourself, man. You got a lot to brag about, too.
I don't like bragging, but
Yes, sir.
My name is Michelangelo Mortellaro, founder of Mortellaro Law. We are Florida's largest elder law and estate planning firm with offices from Miami-Dade all the way to Panama City Beach.
The largest.
And for the last 10 years, we have been the best and highest rated estate planning and elder law firm in Florida. So we have a great team, and I like to think that we help a lot of families every year.
Yes, sir. You do. You do. So I like to always go back to the origins, right? And I want to know what sparked and motivated you to launch Mortellaro Law.
Well, I've been an entrepreneur from a young age. I was a business owner before going to law school, and so the natural progression after graduating law school was to run my own shop. And less than 1% of attorneys graduating law school set up their own law firm, but I decided to do it. And I think it's been good in that I never had formal training from another law firm. So quite honestly, I don't know how other law firms work because I never worked for a lawyer. I never worked in a law firm.
Oh.
And so I just show up every day and I do what I think what I would want for my family. And so I just run it that way. And it's very non-traditional, but based on our growth and our success, I think it's worked.
Yes, sir. Well, it has, because you shared with me some stats here from your TikTok following. And you guys have wonderful engagement, and I love the way you embrace social media and getting the message out there and education about long-term care, right, out to the community in a different way. And I always manifest that my platform was Florida's #1 healthcare and advocacy for edutainment. And I love the fact that you do that. Can you share just your TikTok and where people find you and just how natural and engaging you do and how much effort you put into actually being out there in the public as well?
Yeah, so I started the TikTok channel about 3.5 years ago, really as a educational platform. It was never intended to be a marketing platform.
Right.
after my third day of doing 2 3-minute videos in a row, I did Wednesday, Thursday, Friday. On Saturday, I had 6 phone calls to our after-hour service saying, I saw you online and I would like a consultation. And originally I was like, no, it can't be that easy. It can't work that fast. Most marketing things take months to get any traction.
Yes, sir.
And so from day one, I think people are just hungry for education, and they're not wanting to be sold anything.
Right.
They're just wanting to learn, because especially when we're talking about families in crisis, dealing with a loved one, whether it's physical, cognitive, or a combination of both, the families want to know more, and so we're just there to provide that. And the channel's done very well. If you watch my TikToks, Mortellaro_law, there's no production quality. I don't have lighting. I don't do any special effects.
Don't let him. He been modest, by the way. But go ahead.
I'm literally like at my desk or in my car, sitting at a stoplight, and I pop off a video.
Yes, sir.
But I think people sometimes like the authenticity.
Very authentic.
It's not polished, but it's functional information and education, and people seem to gravitate towards that. So in the last 12 months, TikTok has driven over $2 million of revenue from a stream that I never started as a marketing platform. It just organically became a marketing platform. We don't pay for any promotion. We don't do anything special other than I try to pop on 3 or 4 videos a day. And it's gotten to the point now where we have so many followers and commenters that I don't have to think of content. I just scroll through my comments.
Yeah.
And those are filled with great questions that lots of people have. And I can just jump on and answer questions all day, and I don't have to think of anything new.
2 milli. Wow, man. Congratulations for you being authentic and real, and people being able to see that and connect with that. That's what you get at Mortellaro Law. But I do want to mention, you said about consultation. If you can tell the audience here, families out there that are listening, what's the consultation look like when they reach out to you?
Yeah, so all of our consultations are free. So again, it's part 2 of education. A lot of times we'll hook them online, or our great marketing staff and our community liaisons will get people interested in the topic. And then I always tell people I'd be a teacher if it paid better, but it doesn't, so I'm a lawyer. And so all of our consultations are 1 full hour. I lay out the plan. Some attorneys, many attorneys charge for a consultation up to $400, whether you hire them or not. And the ones that do free consultations often will give you 15 minutes where they just talk about themselves and what they've done, and they don't really give you any meaningful education or information. So all of our consultations are a full hour. We lay out a plan. What can we do? Where are you at? What are your options? And then if you like my plan, we do business. And if you don't like my plan, I always promise that you'll leave more educated than when you came in. And that's my goal.
Yes, sir. So when those families approach you, what's one mistake you see a lot of families make before ever walking into the door or office?
Well, I think a lot of people are apprehensive about seeing a lawyer. They're scary people and they're expensive. And so a lot of people, and usually for good reason, people hate lawyers. Hopefully we're the exception. Yeah. But I think
you're the exception, my man.
I think people wait too long. I had a emergency room doctor a couple years ago, came in for his wife and needed power of attorney and healthcare surrogate. And as I'm talking through him, his wife had completely lost capacity years ago. And I said, I can't let her sign a new power of attorney. She doesn't know what she's signing. And this is a really smart professional in the medical field, in the emergency room, that sees people on their worst day, knew his wife had dementia for a decade, and never thought about, I should probably get things in order, get educated. So I think the biggest thing is people wait until it's too late. Whenever we have cognitive decline, that window is closing. And once that legal capacity window closes, I can only work with the tools that you have. And many times that's no tools, and it's hard to work when you don't have any tools.
Yes. So a lot of people think you have to be broke to qualify for Medicaid, right? What's one misconception you see when it comes down to family actually coming into you, wanting to get their loved one set up with that benefit?
So the reality is, state by state can be very different. So Medicaid is a federally funded program. That money rolls to the states, and then the states distribute it among the needy seniors in their state. If you haven't noticed, we have a lot of old people in Florida that vote. And so our elder law lobby is very powerful. So for the last 40 plus years, we have the ability to do things in Florida that other states simply can't do. So when you go online and you look at, what do I need to have in money to qualify for Medicaid, you're getting different answers from different states. Many of those states are not nearly as friendly as Florida. I can tell you over the last 19 years, we've done over 7,000 Medicaid cases. We've never had a permanent denial. And I've done cases for families with $5,000. My largest single case was over $12 million of assets. Within 30 days of husband hitting the nursing home, Medicaid was paying $15,000 of the $17,000 bill with $12 million in assets. So in Florida, there is no such thing as making too much money or having too much money if you have the right professional, elder law attorney, guiding you through the process, and you don't wait until it's too late, because many of the tools that I use to preserve assets, and we can preserve 100% of assets, vehicles, homes, cash in the bank, investments, and retirement, many of the tools have to be specifically spelled out in your power of attorney. So if you don't have a power of attorney done by an elder law attorney, then you're missing tools. So a lot of people, simply for lack of education, they think, well, I need a power of attorney for mom. So they go on LegalZoom or even go to an attorney, a general estate planner. General estate planning attorneys will give you 5 to 12 page power of attorney.
Right.
My powers of attorney are 32 to 35 pages. That extra page count is all of my tools to preserve your income and assets and let you qualify before you would organically qualify, which for Medicaid is $2,000 of assets. So without the help of the tools and a qualified elder law expert, you got to spend all of your countable assets down to $2,000 before you can ask for federal dollars. With the right tools and the right attorney, we can preserve 100% day one with no spend down.
Right.
That is powerful.
That's very powerful. But it also helps set up families for the best situations long term for generations to come as well. So let me ask you this. Let's talk about starter kits for people that just don't have any idea about estate planning or long-term care planning at all. And we're riding from the lobby floor to the 30th floor on the elevator. What would you advise me, Norman Harris? And I say, hey, what do you do, sir? I'm Mortellaro. I work for Mortellaro Law. I'm CEO. And I ask you a question. I say, hey, what advice would you give me for estate planning for myself?
Get educated, because you don't know what you don't know.
Okay.
So whether you're younger and healthy, we take all the elder law tools and we put them in everybody's documents, even if you're young and healthy, because we're all on the express train to Oldville.
Yes.
And once we get there, we may not be as healthy as we were hoping. And so cognitive loss can come slowly through dementia. It can come quickly through a stroke or a brain injury. I have a 35-year-old client right now in the same nursing home as many of my elderly. He was riding his bike on a Saturday morning, got hit by a truck, fell off, hit his head, and has a traumatic brain injury. So people don't think at 35, I'm going to need Medicaid to pay millions of dollars for my long-term care, but it happens. So if you get prepared early, young enough, healthy enough, if life throws a curveball sooner or later, you're prepared for it.
And getting educated, what's the best place to do that?
This guy. So, again, because our consultations are free, we do estate planning for all ages. I work with a lot of young business owners, entrepreneurs, real property investors. And on that side, we do asset protection in case you get sued. But while we're doing that, we're also doing the asset protection for when you get older and might need care. So asset protection really is about dying with the most amount of money you can die with. Whether that's a little or a lot compared to your neighbor doesn't really matter. Whatever
I like how you
have,
put that.
whatever you have is important to you, and it's important to your spouse if you have one, your children, your grandchildren. So whether it's protecting from a lawsuit from a car accident or protecting from $880,000 statistical average of a nursing home, it's still leaving to the next generation, your family, your friends, your charities, more than you would have if you hadn't been educated and planned.
Right. So let's talk about alignment, because a lot of times families, don't have the education, they don't have a starting point. But it's also good, and as you know, to have partnerships out in the community where families can have those warm introductions or to estate planning or to a service provider like yourself.
Sure.
Right? What are some other businesses, other community partners that would be good to align with Mortellaro Law as well?
I mean, there's lots of them. Financial advisors are a great opportunity because financial advisors get paid what's called AUM, assets under management, and they take a little bit of whatever is in your portfolio to be your financial advisor. So as a financial advisor, if you have a client that's getting old and needing care and they have to call up their financial advisor and say, hey, we need to start draining $10,000 to $20,000 a month out of our investments to pay for our nursing home or in-home care, the family's losing assets. The financial advisor is losing money under management, which means they get paid less. And so by bringing us in as a strategic partner, the financial advisor has the ability to keep that client that trusts them. They make more money on that client, and the client doesn't have to deplete their assets paying for care. It's one of the few situations in life that's truly a win-win-win. The attorney makes some money, the client saves money, the financial advisor continues to make money. Nobody's getting hurt through that strategic partnership.
Right.
Geriatric care managers, or they don't call them geriatric anymore. Apparently that's not politically correct. Care managers. People that work at communities, assisted livings, memory care communities. They love their residents, and their residents are paying them for a service. But if their residents run out of money, they're not a charity.
Right.
So they have to tell families every day, like, hey, you're out of money, got to go find somewhere else for mom because she can't stay here.
Exactly.
By adding, whether it's VA benefits, whether it's Medicaid benefits, we're letting that money that they have stretch longer. So it lets the community keep a good resident. It lets the senior get longer care. And one of the big stresses in life for everybody is financial. Certainly as you get older and you start seeing that you're spending more money every month than what you bring in, you're doing that math in your head. And you're like, boy, I hope mom doesn't die anytime soon. But if she lives too long, we're going to be in a bad situation because who's going to pay for mom's care?
Right.
By adding public benefits and government money to stretch that money longer, we reduce that stress level.
Yes. What about physicians, like mobile physician groups, specialty physicians?
I mean, neurologists are great. Neurologists have the ability to refer to us all day, every day, because as somebody has a cognitive impairment, their window of capacity is closing, and it makes it way more likely they're going to need care than somebody in their age group that's perfectly healthy.
Right.
So neurologists often are, they're laser focused on the cognitive decline, the brain, the science, and the medical side. But if they could take a step back and look more holistically of where can I be a resource for my patients that isn't on the medical side, but on the financial side, on the care side, then I think, again, it's a team. And whether it's the neurologist, the financial advisor, the care managers charge privately. And so if their families run out of money, there's no more money to pay the care manager who's doing a good job and the family wants to continue to use, but now the money's all dried up. So we bring that money component to the table along with probate avoidance, trying to avoid family fights because, death and money change people. So everybody likes to fight about the money when it's there.
Yeah.
And I guess the good side is when we get done with a client, there's more money to fight about, but that's probably not the dynamic they should be thinking about.
Hey, well, I will tell you one thing I've learned when working with Mortellaro Law, but also from our conversation, is that you're very authentic and you can feel the realness, man.
I appreciate
That's
that.
one thing I'll definitely give you that for sure.
It helps.
Yeah.
I love what I do. There's never a Monday I wake up and I have to go to work. I wake up Monday, I get to go to work.
Get to go to work, man. For sure. There's many ways to contact you, but I would like for you to reshare that with the audience. How could they connect with you?
Yeah, so my main office is where most of the phone calls come through, 813-367-1500. You can obviously find us through our website, online, any of our social media platforms, our marketing people. Just Google Mortellaro Law. There's only one of us, and you will find us however you need to find us.
I do have one question. I just checked this paper right here. And what's one mandatory law, if you were governor right now, that you would mandate for the entire state of Florida,
So
related to healthcare?
So from the senior perspective, because that's my only touching of healthcare, is I would increase funding on the Medicaid long-term care program for assisted living and memory care. Because Medicaid works great if you go to a nursing home because they pay the entire bill over your income, so you're not bleeding any money. Medicaid also offers great in-home programs where they can bring home care one-on-one into your home. Doesn't cost you anything. They don't take your income, so you're not bleeding money. That middle ground of assisted living memory care, at best, Medicaid's going to pay about $2,100 a month towards the care portion of your bill. Memory care communities, it's not uncommon, $6,000 to $10,000 a month. So if you make $2,000 in income and you get another $2,000 from Medicaid, that still can leave a negative $6,000, $8,000 a month. And so those families caught in the middle, where they're not good enough for home care, but they're not needy enough for nursing home.
Yep.
That's where they still see that decline in their assets. So I would open up more Medicaid funding for that middle ground to either bridge that gap or make that gap smaller, because that still remains a financial stress for a lot of my families. Is even with Medicaid, even with VA benefits, they're still negative every month, and they're doing that math of, I may outlive my money.
Wow, man, you killed that question. That was a good answer. So, edutainment, you received the education. I hope you enjoyed the show today with Michelangelo Mortellaro. Mortellaro Law, Florida's #1. Thank you, sir.
Thank you, sir. Appreciate it.
Man, yes, sir. Good.
Awesome.
Keeping the momentum going here at Florida Healthcare Association Conference and Trade Show, I have another powerhouse guest with Managed Care Consultants of America, a CEO, Destiny Quinones. Right?
Got it right.
I learned today about the tilter, she said in her name. Right? Joining me today. Thank you so much for joining the platform. I'm very grateful for your time and conversation. Round of applause for you.
Oh, thank you.
Yes, ma'am. So, in comfort measures, the Let's Get Comfy podcast fashion, I always let my guests introduce themselves. I want you to brag and go crazy about yourself, Ms. Destiny.
Goodness.
Yes, go ahead.
All right. Well, my name is Destiny Quinones. I'm a social worker by trade. Went to UCF and have made my time through the healthcare world, from discharge planning at a hospital to admissions director at a nursing facility, and now owner of a consulting company. I'm a mom of one son, and I would like to think a good daughter and sister. Family's super important to me, but
Yeah.
I'm happy to be here, and thank you so much for inviting me.
Of course. So you went to UCF. I went to UCF as well. They say it stands for Under Construction Forever.
Or you
Yes.
can't finish?
You
That's
can't
the other one?
Well, actually, just exposing myself a little bit, I fall into the you can't finish category.
Oh, I do not.
You know
I
that?
did
Yeah.
graduate,
So I
thank
had
you.
to transfer. I had to transfer to Florida A&M University
Okay.
because I could not finish at UCF. Yeah, UCF, y'all owe me some money
Uh-oh.
too, man.
Uh-oh.
I didn't finish at y'all school, but no. Thank you for joining today, and I want to start off a little bit different. If you'll tell me, what are 3 things you like about yourself?
Oh, goodness.
Three
Okay.
things.
3 things. I am on time. If anyone knows me, I am on time to all things. So people know to tell me the right time that things start, because I am the one who's on time.
Promptness.
Yes.
Love it.
Super duper honest. But just with being a social worker, I love people. So helping people, giving advice, and just really, making sure that everyone's okay.
That's awesome. And I can feel it too.
Aw.
I can tell you have a great energy, and you can just brighten up a room for sure. So
thank you.
went from consultant to president to now you're CEO in under a decade, which is very, very good.
Thank you.
Very, very good. Very impressive as well. What was one of the moment you realized that you weren't just going to work for MCCA? Are you actually going to run it?
Oh, I didn't think I was going to run it. That was never my dream. It was never an aspiration that I had. The prior owner, Tim Sullivan, who was an amazing, amazing person, wanted to sell the company to retire. So he trusted me with the organization, and I was totally shocked. So this company is definitely a gift from God and something that I inherited, and I'm very grateful for. But it wasn't anything that I've ever aspired to do. So I know it's a gift, and I treat it that way.
That's really good. Mm-hmm. Well, he trusted the right person.
Yeah.
He trusted the
I
right
like to
person.
think so.
Yeah, that's a real blessing. So with you starting in social work and discharge planning, working in all of those areas, so you've touched on those things. Mm-hmm. But how did that experience help shape the way you negotiate contracts on behalf of organizations or providers?
Well, working in the hospital, I worked in a level 1 trauma center, so we got all the worst of the worst, from burns to gunshot wounds. And, you just see that everyone is there that needs to be taken care of, no matter how much money they have or don't. And then the assistance that they need afterwards, is important. So negotiating really good rates and working with providers that really care about the community is super important for me. So always want to make sure that they get the best so that they can take care of anyone, no matter what, color, creed, money, income. Everyone deserves to be treated, the same. So obviously you need to make some money to do that and give good care.
You got to have the money on.
That's right.
Got to have that money on, for sure. So in skilled nursing, it's often you feel like you're at the mercy of insurance providers, insurance companies. What's one of the biggest misconceptions that providers have in relation to their own leverage when they're looking to partner or with a managed care company or contracts?
Yeah, a lot of providers think that they're being dictated to, that they have to take whatever the insurance company tells them, and that's not true. You have to know what your contracts say. You have to understand what the levels mean, what the definitions are, and if you understand that information, then you have the power to kind of go back, negotiate, make sure that the insurance company is being fair to you, and that you're getting what you need. So I think a lot of times facilities don't realize that they have that power, and if they have the knowledge, then they can absolutely, go to the insurance and make sure they get what's fair.
Yeah. Well, I think that's big because I never, as a former administrator myself, I lean heavily because I worked with you guys when you guys were MCZ of Florida.
Of Florida.
Then y'all
yeah.
became over America, baby.
Yep.
Yeah. You became to take over America.
That's right.
Was that around the time you took over?
Yes, actually, yeah.
And then you said, no, we going to take over the world.
I mean, multi-state.
Yeah, multi-state for sure. So credentialings, there's delays in credentialings that can stall revenues, of course, for months. What's one fix you've seen that's transformed how fast providers get paid?
Well, I mean, just having someone in charge of paperwork and deadlines and making sure that they're keeping up with the expiration dates on things is super important. Having a cheerleader and someone who's like a quarterback to have everything, just together and paying attention, because the second you stop paying attention is when things fall through the cracks, and just making sure that that person really, really is being astute and is just keeping track of things is the most important.
Now, who's that champion person you've seen that you've worked with best, like at the facility level or in the corporate structure of organizations?
Honestly, it just depends on the person themselves. I don't think that it needs to necessarily be a clinical person, a nurse or anything like that. I think it just needs to be someone who is not afraid to ask questions, someone who's super duper organized, someone who pays attention to deadlines, and someone who's gonna, work with the team to know that it's not just their responsibility, because managed care is not just one person, it's the entire facility.
Entire facility. Is there any strategies you recommend, like when dealing with managed care, contracting, you're looking at partnering with other insurance companies? What's one thing you say you would share as a strategy, but also something that organization may overlook?
Well, again, I think a lot of organizations trust one person to be in charge of managed care, and I think that's a mistake. I think that everybody in the facility, from the DON to the administrators to admissions to social services, needs to know their piece of the managed care pie so that they're successful, and that everyone has a vested interest in the success of the contracts and the partnerships with the insurance companies. Because again, it's not just one person's responsibility to know everything.
Right.
Everyone needs to know how much therapy, how much nursing, how can we make more money, who the contacts are. And when you have it that way, and that's the strategy of the facility, not just one person, that is when you are successful.
That's very true. And I'm thinking back when we were looking to land more contracts with insurance providers, you guys were very attentive, very communicative. The emails, I can't remember her now. I want to say, was it Alana
Yeah.
Williams or
Yep.
Alana Hansen or something like that? I think I worked with her in the past.
Yeah.
And I got to give her credit. Big shout out to you. I remember your name too.
You sure did.
Yeah, but yes, you were very communicative and informative. We've always had her as a resource throughout the process, and that actually helped educate my team at the time as well. So that's a great thing that you guys provide, is being available
Yeah,
to
'cause
your facilities?
I mean, it's important to get contracts and to negotiate rates. That's kind of half of the model with MCCA. But once you get them, what do you do with them? You know, how do you
Right.
operationalize them? So
Exactly.
Alana and my other liaisons are there to help the facilities work through it. How do you get off? How do you case manage? Where do you go? What portals? So yeah, having that boots on the ground person to come to the facilities and to handhold, accept the phone calls, the emails, you know, from your staff is super important because things change. Insurance
Right.
companies change things at the drop of a hat. Medical directors change and they want to put in new policies and things. So it's important to keep up with that.
So, what levels of in the long-term care space or healthcare in general? What levels of care or areas of care do you guys partner with, like ALFs,
Yeah.
inpatient rehab hospitals? Or review that with us.
Yeah, so when we first started, it was only skilled nursing facilities.
Okay.
So fast forward, 80% of our business is still skilled nursing facilities, and we operate in 9 states. But we also work with assisted living, home health. We're starting with some DME companies. We have
Okay.
infusion, hospice, behavioral health networks. So we really diversified our portfolio over the last about 10 years to work with other providers that are interested in managed care because it's not going away and it's not something that's ever going to stop. So it's been interesting to learn new things and to be in different spaces because, you know, again, we all know sniff, but learning the other things has been a challenge, but good.
Oh, it's been a child. Okay.
Yeah.
So, how do you provide education for like those home health agencies? And matter of fact, let's do this. Your elevator pitch.
Okay.
Let's hear an elevator pitch because you guys have diversified your portfolio and your partnerships and in the long-term care space with different organizations. But tell them why they should partner with you all.
Okay. Well, you should partner with MCCA because we say that we're the experts. You know, we work with the insurance companies to negotiate the best rates possible, keep your credentialing current, and to be that point of contact for education. So when there's turnover at your organization, when you have somebody new, you can trust that we're going to be that, you know, person or people to help make sure that you guys are successful and are always in the know.
Do you guys work with any like home care, private duty agencies
Yeah.
at all? Because a lot of them are, a lot of times they try to go private pay route, but pretty sure they would like, you know, have some insurance partnership or anything like that.
Oh yeah, we deal with a lot of home care agencies that have Medicare certification,
Okay.
and Medicaid certification, private duty for sure, a lot of Medicaid space, and we do that here in Florida and in Texas.
Okay. Trajectory. We talk about projections, 2027, 2028. Where is MCCA now? Because you took over America. You said.
Oh boy.
Now, would you be going to like? Would it be MCCIC? International. You know what I mean? What you think? You tell me.
I mean, sky's the limit. I never put a cap on our growth and our experience. I think that I would like to operate in maybe like 25 states.
25 states.
Yeah,
Okay.
I think that would be really cool. Hire some more liaisons in those states to support the organizations properly. But listen, you never know. I don't know if there's opportunities in Thailand. in
yeah.
Hawaii, Japan. I
Japan,
don't know. We'll see.
yeah. Destiny Quinones. She'll go over there. She'll go over there. MCCA.
I will definitely go.
Yes. Managed Care Consulting of America. Thank you so much, Destiny, for joining the platform. It's been enjoyed this conversation. Your final thoughts for future clients out there. Final thoughts from you, but also how can they reach you and connect with you all?
Yeah. So, I mean, managed care is confusing, it's frustrating, and everyone hates it, you know, because it's just difficult. But if you team up with an organization that tries to make it easy for you, you're definitely winning. And hopefully that team is Managed Care Consultants of America. Again, my name is Destiny Quinones, and you can go to our website at managedcareconsultantsofamerica.com and kind of piddle around, see what's there, and you can definitely call our office, email us, or you can definitely contact us there.
Yes, you killed that one. You did it. You did that one. You did it. All right, thank you so much. All right.
Thank you.
All right, thank you.
you.
All right, we good. Good job.
Awesome.
Yes,
That
how
was
you like that?
fun. That was
You did
fun.
good. You weren't nervous at all, man.